Good afternoon, good evening, everyone. Thank you again for attending Ken's educational series, Managing Survivorship. And we have a very interesting topic today, something that there's a mystery behind it, or some people are afraid of it. They have concerns about um, this topic. This is about clinical trials. So, each month we want to focus on topics. The topic this month is clinical trial. It's understanding clinical trials and as a part of your treatment care, treatment option. So a lot of you didn't recognize that clinical trials are part of your treatment options. So today, to kind of give you an overview, I'm going to give you some background about clinical trials. And then we have a special guest from um, TLEX, medical director of TLEX, Ms. Kimberly Allman, will talk to us. We'll have a kind of a chat about this topic. I'll then cover three clinical trials that to just bring awareness of the different type of clinical trials that are available. And these clinical trials will go into more detail in a clinical trial learning session over the next 2 weeks. So uh, I would also like to take the time to thank our sponsors. And then, Jerry, can you put up the pre-survey? Okay. And while we go over some housekeeping items, I want to thank our sponsors. And it's Amgen, Bayer, the Dana-Farber Cancer Institute. This is our host institution. Alexis, Johnson & Johnson, Merck, Novartis, and Pfizer. And without their continued support, we wouldn't be able to deliver more detailed, more candid discussions between the people in the field, the patients, the caregivers, the physicians, healthcare providers, and also the folks that manufacture the treatments, the ones that we're using now, as well as the treatments in the future. So, Jerry, how are those coming along? 1 more minute. Okay. So, I want to remind everyone that clinical trials are voluntary. So that's a key point I want you to recognize. If you participate in a clinical trial, you can always decide to quit, leave, and they're voluntary. I also want to let you know that the information that you receive tonight is educational. And if you have specific treatment questions, we would kindly redirect you back to your treatment team, where they serve as your best resource. Again, this is our Managing Survivorship educational series, and we host this once a month. And today we're focusing on understanding clinical trials as part of your treatment options. But I'd like to give you some background. So, clinical trials, what are they? And a clinical trial is a research study with people. Now, it tests a new way to prevent, to find, to treat, or manage disease. It may compare a new approach with current care, which current care, think of is the standard of care. It follows a written plan, which they call a protocol, and it asks clear questions and tracks the results. So, why does this matter? Trials help doctors learn what's safe, what works, and what may improve care for future patients. Now, some key points for the patient, and then really the key points for the audience, is joining is your choice. You can ask questions before you decide, and you should talk to your care team about your clinical trial. There's some key terms that you're going to hear. And whether it's tonight or when you talk with your care team or a clinical trial investigator, an informed consent. Now, this is the process of learning the study facts before you decide. It covers the purpose, the risk, the benefits, the cost, and even your right to leave. The protocol is just a written study. Eligibility criteria, the rules, you can join what you have to use to join the trial. They may include cancer type, past treatments, test results, and overall health. Now, randomization is you'll hear that term, but it's a fair way to place people in study groups by chance. So researchers can fairly compare the results. And then the last point, which I said earlier, was the current care or standard of care is the usual care doctors use outside a trial. Now, that's important. I say it again. It is this usual care doctors use outside the trial. And what you're going to do is anytime you're in a research study, you should always ask what the standard of care is. And if you don't understand something, ask to explain it. How do trials move from evidence to move from idea to evidence, as I said in reverse? But you start at the laboratory bench, and they classify all the research that's done outside the human body as preclinical. Then you move into a clinical trial, and in a clinical trial, there are about 4 phases that are in a clinical trial. That's phase 1, phase 2, phase 3, phase 4. Phase 1 is really about, is it safe? Is the drug that we are investigating safe? Even though there's a lot of research in the preclinical state, it's already demonstrated it works, it's safe, but it has to move from the animal model into humans. Phase 2, does it seem to work? And then we move, if it seems to work, then we move to phase 3. How does it compare with current care? And then lastly is kind of like a little bit like what's happening in the real world. What do you learn after its approval? So how are people from different walks of life, different racial groups, urban, suburban, where you live, how does it impact your treatment and your care? Now remember, every trial has a plan. That protocol examines who can join, what will happen, and how safe the trial is, and how safety is checked. Now, what the patient can expect, you're going to talk to your care team, and then you're going to be pre-screened. And if you're pre-screened, you'll learn and consent to the study. You may have some screening tests that you have to take, and then you'll have visits and safety checks, and you're watched very closely. So you think of clinical trials almost like concierge medical care. There's a lot of people involved in making sure the clinical trial is safe. There's a lot of people always checking in on you. So you want to ask about support also. You want to ask whether, visits, tests, travel costs vary from trial to trial. So ask if these things are covered. And remember, you stay in control. You can ask questions at any time. You can also lead the trial at your choice. Now, on the left side, we have some questions. And also you can take your phone. And if you'd like to look at clinical trials, you can also go to the portal I'm about to show you, which is fintrials.com, and how you can find a clinical trial for prostate cancer. So if you've ever looked for a clinical trial, it's complicated. They direct you to a clinicaltrials.gov. And I'm going to tell you, if it's complicated for the patients and it's complicated for the doctors, it's very difficult. And it's not like it's hard to read and understand, but the problem is, how do you get to the trial for your particular treatment? So what we did at Fin was we recognized that. And because we focus in the prostate cancer space, all we really needed to do is really know what your diagnosis is and what state you live in. Now, I'll Pick someone with intermediate risk who lives in, well, now Florida's too hot, but I'll go to Florida. And we'll search. And what you'll have is, in the state of Florida, 26 clinical trials for an intermediate risk person. Now that narrows down somewhat over 600 clinical trials that are active, they're out there that are actively placed on clinicaltrials.gov. Now we take it a step further because you look at this and it's like, we recognize that. So we take it a step further and we try to change the information around so it's easy to read, easier to consume. You want to know, well, is it actively recruiting? Yes. What phase of the clinical trial? We talked about the phase. This is the phase. Now it's the larger phase. And age group and the enrollment. The enrollment is how many people want it. And then we do break it down so it's easy to read. We give you a summary, we give you a description, but also we let you know the location. And by clicking Google Maps, it'll give you the exact location it's located, the address. If you go back further, we also have the contact information. And this happens to be an AstraZeneca study. And they give you a number to call, plus an email. So that's a start. And that was fairly quick. Now that we've kind of gone through a tool that you can use of giving you some basic information about clinical trials, what to look for, what to think about. Now there's a tool that can help you identify your clinical trial. Now I'm going to stop sharing. And what I'd like to do is bring in our guest. Now, our guest is the medical director at Telix. They make a wide variety of treatment options. Matter of fact, they make things for diagnosing the prostate cancer. They make therapies or drugs that treat the cancer. And also, if we have time, we may hear about drugs that even help deal with pain associated with advanced cancer. Ms. Kimberly Allman, Ms. Allman, welcome. And thank you again for taking time out of your day to talk with us. And we have some points, some key points that we're going to cover. And we're going to talk about what is a clinical trial, what do trials matter, and how trials work. And also, you may be able to have to help a little bit about what are the patient's rights. And then if we have time, what we'll do is kind of hear a little bit more about the type of therapies and diagnostic tools you create. So, excuse me. The first thing I like to do is get you to say in plain language, excuse me, why are clinical trials important for the prostate cancer patient?
Well, thanks so much for the kind introduction, Dr. Crawford, and I appreciate the opportunity to speak with you and the attendees this evening. So, clinical trials are important for prostate cancer. They're really important for all cancer and all medicines in particular, or all of medicine, rather. So, before I started working in the biotech industry, my background is as a nurse practitioner. And so I've got about 20 years of oncology experience working directly with patients. And so, specifically with prostate cancer, I started in the space around 2014. And I think of what was available for treatment then. And we had an injection, we had a couple new pills that had started, we had chemotherapy, a couple kinds, an injectable form of radiation, and a new immune therapy. And I think about today in 2026, all that we have available. Not only do those same medicines still exist, but now we have new medicines. Now, sometimes we understand if we draw blood work, it can give us a little signal that one medicine may be particularly helpful for this patient. We've also found that sometimes combining medications, whether it's two together or three together, can be even more helpful and keeping the disease under control, shrinking the size of the disease, or helping patients live longer. So, really, the short answer to your question is that with our increasing understanding of science, we learn how to take care of patients better and help patients feel better during their treatment course.
Hmm. So it's interesting. We're talking about 14, what is it? You said, yeah, 12 years?
Yes,
Really?
yes,
In 12 years, a little bit over a decade, we've come to these advances that weren't even thought of a decade ago.
exactly.
So let's ask this one question, and I know everyone in the audience basically has this feeling about clinical trials really being misunderstood, and there's a common myth about clinical trials. What would you tell the audience about? And that myth is about safety being experimented on like an animal, or not trusting um, the clinical trial itself. What would you get them? How can we dispel this myth about the safety, the lack of safety in clinical trials? Is really the myth.
Yeah, I think that's a really good question and one that I'm particularly grateful that you brought up. It's very important that everybody understand this answer before participating in a clinical trial. So there are several layers of safety checks by different authorities. So to back up to the very beginning, before a clinical trial is executed, there is a lot of what we call cross-functional contribution inside the company. So we have scientific experts, we have health authority experts, we have safety experts, we have experts in the preclinical space, which is all the blood work and animal studies that are done before it gets into a human. So many different eyes with many different perspectives are taking a look at the protocol to develop it. Now, at several stages in its development, it is reviewed with health authorities. In the US, ours is referred to as the FDA, which takes a look at drugs. So their expert physicians, clinicians, internal staff will comment back to the company and ask for clarification on different things or make suggestions or recommendations. So there's a built-in safety check with the health authority before it even gets activated or open. Then, after it passes all of the multitude of litmus tests with the FDA, it goes to the institutions, what we call IRB, the Institutional Review Board, which is a group of doctors and ethics experts and nurses who review the protocol to ensure that it is safe to execute with patients at their center. Similarly, they can provide back questions, ask for clarification, but there is a very exhaustive review that's done before it even opens at a center. Then, when it's presented to a patient, the information is written at a patient understanding level. So, although the individuals who develop it have expertise in medicine and science, it's important that we all understand all of the requirements and risks and benefits of a clinical trial. So, that is called an informed consent form. So, either a clinical trial nurse or a research coordinator will go through the informed consent to discuss the medicine or procedure itself, the risks and benefits, and provide a multitude of opportunities for you to ask questions as well. So, those are just the steps before, and then you are seen regularly by your healthcare staff looking at blood work, physical exams, scan results to do an ongoing assessment of safety.
Mhm. So the takeaway message here is safety, safety, safety. Safety is the priority, and having multiple groups. And there was something else I wanted to ask you on that IRB review committee. Do they, some of these committees have people from the community that sit on these? So it's not just healthcare professionals, right?
Yes.
And so people from the community are invited, community leaders may be invited, or doesn't even have to be a leader. Somebody may be selected from the community who's interested and they participate that and review with the healthcare professionals to kind of let you know that there's somebody outside the health profession that's also taking a look too for safety. Now, there's an issue about clinical trials. And when should I ask for the clinical trial? So do I have to be on my deathbed to ask for a clinical trial?
Oh,
That's a
Right?
great question.
That's what people, you hear somebody laughing in it, that's what people think. But they don't. And some of them are aware of it, or obviously the audience is aware that you should ask for it earlier. But a lot of people think that it's like clinical trials for people with neurology. What would you say to someone who thought that?
That's a really great question too, Dr. Crawford. So I can say that there is never a wrong time to ask if a clinical trial option exists. As you mentioned, I think a common conception of clinical trials is that they're only available for patients who have run out of options, but that is not the case. We have clinical trials that start even prior to cancer being diagnosed that can help us detect better or help us discern better the extent of the cancer. So, clinical trials are available in a diagnostic setting before cancer starts, throughout the course of cancer, to assess how well the medication is working in any number of scenarios. And the same thing exists for medication trials, is that they can start just as the cancer has started, all the way to where a patient may have used what is standardly available. I do think a common misconception also with clinical trials, uh, thinking back to the last question, is that if I don't hop on a clinical trial, or if I do, I'm going to get a placebo, which means nothing. The only
Hmm.
time that a placebo would be offered as a clinical trial, number one, you would have full visibility to that. And number two, if a standard of care does not already exist. So, in short, only if you would not be offered anything else at that time would be a time that a placebo could be part of a clinical trial. Otherwise, it would be unethical and people would not offer that trial.
So for the audience, placebo, people have said sugar pill. So, but the key take home message is this. And Ms. Allman has stated before, between 2014 and 2026, there's been a significant increase in the treatment options that are available. So there is at least a standard of care that you would have if you didn't receive the drug or the treatment option, the experimental treatment option. So that's no matter what, you will get the standard of care for prostate cancer at that time. That's very important. So, but now let me ask you this question. Now we understand we should ask for the clinical trial, but how does the patient, these people who care for you and you're trying to be careful not to hurt their ego or whatever, how do you ask a doctor or the healthcare team about clinical trials? To just go out and ask them, or because some people are just afraid to to ask, to step on people's toes, or make them feel as if, well, your care isn't, I want more. You're not giving me the best care. What do you think?
Coming from a clinical background, being on the other side of it, I would never be offended if somebody asked me about a clinical trial. It is so important for you and your loved ones to know the full range of everything that's available. So every healthcare provider welcomes a question like that. I think it was a fantastic resource that you shared earlier in the presentation, Dr. Crawford, for fentrials.org, where you can put in the very basic information that you need to know, your risk category and where you live, and you can see what all you may qualify for. That does not require you as a patient or your loved ones to make heads or tails necessarily of what trial is most appropriate for you, but that gives you a sense of what may be available and having that discussion with your clinical team. Please remember that everybody who works as a physician or a nurse or a pharmacist or any part of your healthcare team had to learn all this stuff at some point too. So these questions never too small a question. We want to make sure that you're fully informed, and we want to make sure that we answer all of your questions. And it may be something that, geez, it didn't pop up on that first call, but I was thinking about it a little bit more. Now I have another question. Please reach out to your team to get that question answered. They'd be happy to answer anything. That's why we're here.
So you're telling the audience that it's okay, and your team wants you to ask these questions. You can reach out to them and know there's no dumb question. Is that what you're saying?
Absolutely not. Yes.
So then now we've talked about the clinical trial. Now let's move into the point where you've spoken, you've identified the clinical trial. There's this term, a document that you talked about. What's this informed consent? What would a patient, what would any person, patient, caregiver, anybody online want to know about the informed consent? What am I supposed to get from that document?
Great question. So the informed consent document really details on a non-medical personnel of truly lay understanding, anybody who has no scientific background, the reason that we're conducting the clinical trial. So it states the purpose. It also details the risks of the clinical trial so that you have the full information available, as well as any benefits that could potentially be gained from this. It really, in very fine detail, will outline all of the expectations and commitments, which we call procedures within the clinical trial. So, how often you would need to come in for visits, when would you need to get blood work, if any? When would you need to see the doctor and healthcare team? What would you need to report in particular? So, from very start to very finish, it details everything that is asked of a patient or shares with them the entirety of the trial, purpose, safety, risks and benefits, everything that is required within participation.
Okay. All right. So this informed consent is you have to read it, and you told us earlier that there's no dumb question.
Mhm.
So if you don't understand something in the informed consent document, ask. Is that what you're saying?
Absolutely, yes.
Okay. So now there was something else that was interesting, and we tried not to gloss over some of the difficult topics, but many drugs have impact people differently, and they have a side effect associated with it. And are the patients monitored for these side effects?
Yes.
What happens? What's because you hear a lot about the side effects. Or tell us about that. How are they monitored? What's going on there?
Yeah, that's a great question. So patients are definitely monitored. So as I mentioned in the informed consent, it will tell the patient and the family members when exactly scheduled appointments are to check in with the physician and healthcare team. So safety is assessed during all of those appointments where they ask you how you're feeling. How is this side effect? Are you experiencing this? If you are, is it mild or low level, or is it a little bit more intense? They can also check for safety within blood results, something that we may not be outwardly aware of, but that we can find in blood. Or similarly, we can do that sometimes in urine or in scans, depending upon what the clinical trial requirements are. So, those are the predetermined times that you meet with the physician and healthcare team where safety is assessed, but you can call anytime too. And in fact, we encourage it. The healthcare team wants to know if and as soon as you have side effects, so it can be documented, treated, and perhaps they may need to tweak the dose of medicine too. So we want to hear about side effects not only at these scheduled appointments, but also when you're experiencing them, if you are, during those in between times as well.
Oh, so you don't have to wait until you may take a dose of medicine and then 30 days later, let them know on your next visit. You're saying if it happens, you can notify them right then and there.
Absolutely. We want to know as soon as any side effects are experienced. There may be medications that can combat the side effects or make you feel better. They also may put you on a temporary hold or a break from the medication, or they may say this might require a little bit of an adjustment. But the sooner we can get to side effects, generally the better managed they are, and you start to feel better immediately too.
Oh, and this is very important because a lot of people will quit a clinical trial because of the side effects, but you're saying that don't wait to talk to you earlier so you can provide the appropriate changes or modifications or even additional medication that can help manage the side effects. And side effects don't have to be brutal. It could just, you're going to the bathroom a lot, or you may have loose stools or something like that. And those kind of issues come up. And so I just put that out there. Now, here, here's a person. They talk to the care team. The care team says, yeah, let's look at some of these clinical trials. They're going to fintrials.com. Uh, they pull it up. And matter of fact, that's a point I wanted to bring up, that patients can pull up fintrials.com on their phone. So they can sit at the doctor's office. If the doctor had a laptop or a tablet, they can either put it up on the phone and say, this is what clinical trials that I've found. What are your thoughts? And so, and that's good for a lot of doctors are using, healthcare providers are using Fin trials just for that, because they don't have to go search, because it's already difficult for everyone. I mean, even the healthcare professionals are having a difficult time looking for a clinical trial. But fintrials.com helps them out. Now, I wanted to say that. So we got this person in the informed consent, read it, understands the side effects associated with it, recognize it's a safe clinical trial. But you know what the problem is? Sometimes people don't live very close to the clinical trials. And if you've ever been in Boston, to park in Boston is expensive. So there's all this costs that may be associated with the clinical trial. Will the sponsor of the clinical trial, the pharmaceutical company, biotech company, help cover some of those expenses?
Absolutely. That's really one of the great benefits of being enrolled in a clinical trial. You will hear during those early conversations before committing or signing consent to a clinical trial just about what reimbursement exists. So it could be reimbursement for travel, reimbursement for parking, vouchers for food while you're at the institution. Generally, many of the healthcare activities are taken care
Mhm.
of. Certainly, the experimental medication is provided at no cost, and many of the other blood work, scans, hospital visits, etc., are covered because of your participation in the clinical trial. So during those early stages, it'll be reviewed at the full extent for the particular clinical trial, what reimbursement or proactive covering the sponsor or pharmaceutical company does in advance for patients who participate in clinical trials.
Hmm. So we talked about cutting edge technology, right? Concierge medical service, safe. So the more eyeballs, more people looking in from so many different areas, the safer the trial. The safer the trial. Now, I wanted to move on. You guys do prostate cancer research. You have clinical trials. Um, Tell us a little bit about. I know you're in the diagnostic space, and then you have treatments also. So, can you tell us a little bit about what you do? What your company does?
Yeah, absolutely. So many of you may have heard over the years, as I mentioned earlier, we get smarter about science. We learn more on a very basic level about prostate cancer itself, the tumors themselves, and that allows us to develop better medications or better diagnostics. So, in recent years, a lot of discussion has been had about a new, what we call a receptor, but essentially an antenna that sticks outside the prostate cancer called PSMA. And that stands for prostate specific membrane antigen. So, in essence, PSMA is pretty uniquely expressed on prostate cancer cells. It can be expressed at low levels in other parts of the body, but to a lesser degree. But because this is so regularly and highly expressed, meaning there's a lot of antennas on the prostate cancer, that kind of tells us it may be a target for both diagnostics, which is the imaging, and therapeutics, which is the treatment. So, one of the clinical trials that we have at Telix is in the diagnostic space. So, there is an injection that you can get that almost like GPS finds the PSMA, and essentially it has a little light bulb on the back of it. So, it illuminates all of the cells that have PSMA in it. So it can tell us more precisely where prostate cancer may be, and not only where it may be, but the full extent of the prostate cancer. So, one of our clinical trials, as I kind of alluded to earlier, is really even before a patient gets a formal diagnosis. A lot of times, for a workup for prostate cancer, an MRI is completed. But an MRI doesn't have the 100% accuracy to tell us the full extent of the prostate cancer, but it can tell us how great of a risk there may be by some classification called PIRADS, which essentially says, are we lowly confident that there's not prostate cancer, or do we have a high degree of certainty that there may be prostate cancer? So, for those patients that have that lower level of certainty, but it's not a no, we have a diagnostic trial that says, paired with MRI, can we inject this radiopharmaceutical, which has that light bulb on the back, to see if A, there is cancer, and B, can we identify the extent of it, kind of paired with prostate or paired with MRI? And that's called the bypass trial. Ultimately, what we're looking to do is a current standard of care in the prostate cancer diagnosis area is it involves a series of biopsies. We certainly understand that biopsies are not comfortable and would like to limit the extent that they are required. So, with this study, we're aiming to say, can we do less biopsies and still have greater accuracy of our detection of prostate cancer? So that would be one example of a clinical trial that we have. But as you mentioned, clinical trials really span the disease journey. So we have some for patients who have more advanced prostate cancer. So I know you mentioned earlier, there are some that may not necessarily be intended to treat prostate cancer elsewhere, but can palliate or help symptoms. So it's not uncommon for patients with advanced prostate cancer to have prostate cancer in the bones. So if it is in the bones, there is potential for that to cause pain. And there are certain things we can do, like pain medications and sometimes external radiation, where we give beams from the outside that disrupt the tumor cells and can break them apart so that they're not causing pain. But those may not be helpful in every circumstance. So, similarly to how I mentioned that we have an injectable imaging agent, we also have injectable radiation agents. So, we think about radiation normally comes from the outside in and has to go through patient skin and possibly other organs to get to the tumor area. When we give injectable radiation, it's looking specifically for that PSMA. So it goes through the blood system and finds the PSMA and can attach not a light this time, but what we call a radiation payload. So essentially a burst of treatment radiation. So it can give it directly to that spot where the prostate cancer is causing pain in the bone. By giving that very precise radiation, you can break those cancer cells so that it reduces the pain that a patient may experience. And that's called the Solace trial.
Wow. So it is amazing. And it's something that you said. And 2014, would you have even imagined that we would have the ability? And see, the studies that you're doing are building upon options that exist, but you're broadening and options for the patient. So we have the ability now. We didn't have it in 2014. And we barely 2022 is when we started getting the opportunity to see more in detail. The more you see in detail, the better the decision that the clinician, the healthcare provider can make when treating your cancer. So what was maybe a guess back then is that you're going to biopsy and I don't know where it is. Now you incorporate MRI and you get a better look at what the prostate looks like. And then you guys come along and then create a compound and a diagnostic tool that allows you to see, like turning on the lights in the Christmas tree. So you have this Christmas tree and then you have all these large ornaments you can see, but you can't really see the lights until you turn the lights on. And now you can see those. And then also managing pain. So it's important. I mean, no one would think about, clinical trials of pain management in cancer. So before, right now, Jerry, I would like to take a few minutes and any questions out there that anyone would like to ask.
I think what show me. Okay.
Okay.
What you're describing sounds to me like they are clinical trials for either pharmaceutical interventions or diagnostics or radiation procedures. Where do clinical trials fit into the surgical world?
Yeah, that's a great question. So I think a lot of times when we think about clinical trials, we think about medication. But to your point, clinical trials is really what informs all types of medicine. So it informs medication, it informs radiation, it informs diagnostic, it informs disease monitoring, and it also informs surgical approaches. So a surgical clinical trial could say, if we do this kind of surgery versus this kind of surgery, which one may be better? Or do we see better outcomes? Or is a patient's recovery time faster? So the same concept exists in the surgical discipline as well.
Okay. Questions?
Yes.
Oh,
Another,
there's one thing I wanted to ask. 2014, did they have robotic surgery?
No.
No. Now we do.
Yep.
So robotic surgery almost brings the quality of surgical care higher, consistent. So you won't have that variability between surgeon skill set with robotic surgery. Amazing. So look at how far we've come.
Okay. Glad to be here today, then.
Jerry?
how are patients protected in clinical trials? Can the patient leave a trial?
Absolutely. So I know Dr. Crawford mentioned this at the beginning of the presentation, but patients have the opportunity to discontinue their participation at any time. So as he mentioned, this is 100% voluntary. So there is no need to participate, or if during your participation you wish to discontinue, you can stop at any time. What I would encourage everyone is prior to discontinuing a clinical trial, please have a discussion with your clinical care team. If there are questions unanswered, concerns that you have, they may be resolved with a discussion with your nursing staff or physician or pharmacist, or they may go back to the company that's sponsoring the clinical trial and get any of those questions answered. But absolutely, you can discontinue your participation at any time. And referring to the safety monitoring, we mentioned that there are those scheduled appointments, which safety is assessed in many different ways: physical exam, blood work, different testing, your report, or even a quality of life questionnaire where you say, I'm feeling good today, or I'm not feeling so good today. But also, any time that you're not feeling well, you're encouraged to call your healthcare team, as there may be a significant amount they can do to make you feel better.
Okay. Does
Okay.
this diagnostic trial also include patients who have cancer recurrence?
So, not this specific clinical trial, but yes, clinical trials do exist in that space. So, it exists with this agent that I was referring to that is called a PET, positron emission tomography, very long name, but all that to say that it's an injection that has a light on the back. So, we mentioned that clinical trials look through the entirety of a patient's disease journey. So it can be as early as prior to a formal diagnosis to where we're starting to see PSAs rise, or after you've had your prostate removed or radiation and we start to see some recurrence. Can we maybe see more than we did before? It can even help us detect what patients may be appropriate for different therapies, because if we know that they have that PSMA receptor, then we can say, well, we can give a therapeutic that targets the PSMA receptor. So this diagnostic can be evaluated in many stages of the patient's disease, as well as other diagnostics.
So what I wanted to do, I wanted to I know we may have some other questions, but do me a favor. If you had a minute, doesn't have to be exactly 60 seconds, but if you had a period of time, the audience here at the Dana-Farber and then online, what would you want them to walk away with when we're talking about clinical trials?
So many things, and so many things that I think that we've covered this evening. So several things to tag on that you mentioned previously. While your healthcare team may know and have many clinical trials, please feel free to bring any clinical trials that you find to them to ask if they may be appropriate. Because so many clinical trials exist, it's very possible for your clinical team to not even know about a clinical trial that may be right for you. There is never a wrong time to ask for a clinical trial. You can ask at the beginning, of your disease. You can ask in the middle of your disease or when you've had several therapies. And clinical trials open and close periodically based on enrollment. So let's say a clinical trial enrolls the number of patients they were looking for, well, then it'll close for a period of time. So that may not be available, but another one may be. So if you've asked now, it may be worth asking again here, there, the next time, because new things are constantly being offered all of the time. I do want to reinforce that your participation is completely voluntary. You can discontinue at any time, and there is no dumb question at all. Remember, everybody who's going over this stuff with you has asked these same questions when we were learning about this stuff too. There is no question too small, and there are often many, many resources available for patients who have cancer and are on clinical trials. So make sure that you ask about the risks and benefits and you understand them fully. How often you need to attend meetings with your healthcare team if you're on a clinical trial, if there are standard of care options, what data may be available on this current option before it's going into clinical trial, and then what resources would be available, as many of these things are covered financially for travel, reimbursement, etc. So there are no dumb questions, and I do encourage everybody to take notes during that. It's so hard to remember the full extent of the conversation, and it can be helpful to bring someone along with you as long as you're comfortable with them, as you know, having a second set of ears to hear a lot of the material can be very helpful.
All right. So I want to take a minute. I want everyone to thank Ms. Allman. We're going to do a survey, but I also wanted to say kind of a recap. So your company produces, they're looking at the protein on the surface, which is PSMA, right? And that can be used as a diagnostic marker or a treatment marker.
Exactly.
And so that's just one type of clinical trial. And so what I wanted to do is let the audience know that there are other clinical trials that we have on fintrials.com, that we have friendly patient summaries. And they're from another one of our sponsors. Merck has an Omaha 003 and 004. And AstraZeneca has an EvoPAR, and it's prostate 2 clinical trial. And what I'm going to do is, while I'm going to take a second and share. Take you back to FinTrials. So you know where it is. If you remember fintrials.com, if you go up high, you'll see that under patient summaries, it'll give you a list of clinical trials. And so what we've done with the clinical trial is we stay very close to the description of the clinical trials that's been approved. Remember, we talked about the committee, IRB committee, and these folks make sure everything is precise, everything is said correctly. So what we wanted to do is just bring to your attention next week, Wednesday, we will have a learning session that'll be talking about the Merck clinical trial and Omaha 3 and Omaha 4. So they're right here. So if you want to get an idea of what these clinical trials are about, I invite you to go to these clinical trials, take a look at the Merck clinical trials. But also, now that's March 20th. Now, March 27th, I also will be talking about another clinical trial. And it's the Evo Par Pro 2. And again, it's for high-risk patients. The Merck clinical trial was for metastatic castration-resistant clinical trials. So remember, depending on your diagnosis, will determine what clinical trials you may be eligible for. So I invite everyone who's on here and online, if you are interested in some of these new clinical trials, take the time, go to fintrials.com, look at the patient summaries, and we have those written up for you. So thank you. So is there any other questions that that you may have while we're waiting for folks to finish the survey question?
There was one specific question about cost. If I go to it, someone asked, is the cost of clinical trials covered by Medicare?
So is the cost of clinical trials covered by Medicare? Your thoughts?
Yeah. So, in advance, prior to any participation, you will know the full extent of anything that is required for your own coverage. But as I mentioned before, a lot of things, particularly that which is outside of the bounds of a clinical trial or outside of standard of care, is fully covered by the sponsor. But have those discussions with your healthcare team as it fluctuates between clinical trials, just to make sure that you have a full understanding of what is covered. But generally, anything beyond what is typically covered for routine standard of care is usually covered by the sponsor of the clinical trial, which is the pharmaceutical company.
Okay. So, yes, question?
As part of my diagnostics, I had a PET scan to find PSMA, but they didn't tell me I was part of a clinical trial. So is that different from what you were describing?
Well, the PMSA
Yeah.
that you used was already FDA approved.
Okay.
And now Ms. Allman's company is in a more advanced
Okay.
technology that no matter what, if you're introducing a drug or a diagnostic tool for safety purposes, right?
Right.
You have to do a clinical trial. They would have told you if you were in a clinical trial. That's the point.
But I'm just worried because what she described sounded like something I already did, but it was not part of a clinical trial.
Yeah.
Okay.
But if you were, I mean, am I right, Ms. Allman?
Yeah, that's exactly right. So PSMA diagnostics have been approved for some time now, but generally when there's an approval by the FDA, it may be in a limited space. So it may be for initial staging to kind of see the full extent, or if a PSA is starting to rise, you may be able to get one there or to help select therapy. But we need to do continued clinical trials to show that there's utility at different points throughout the patient's disease to say, yes, this is good to use there. So it was what you would have received would have already been approved. You will always know if you're in a clinical trial as it requires your voluntary participation. But we continue to use some things that have been approved already in clinical trials in the future to see if we can use them in different parts of the disease so that we can expand the use of the technology.
So what is our take-home message?
Thank you.
Our take-home message is this. If you didn't read an informed consent, you didn't participate in a clinical trial.
Okay. Got it.
So at least that's something that we can walk away with
Yeah.
clearly. So Jerry, how did the survey questions, are we finished? Okay. So now I'm going to read the question and then I'm going to tell you what the response was back from the audience. So after this session, how clear is your understanding of a clinical trial? 80% were very clear, 20% somewhat clear. Okay. After this session, how well do you understand how clinical trials may be part of your prostate cancer treatment options? 96%. So you did a great job.
Yeah.
Kimberly. So excellent. After this session, how well do you understand when a prostate cancer patient might ask their care team about clinical trials? 86% very well, and 14% said somewhat. How confident are you now that you can ask your care team informed questions about clinical trial design? Very confident was 72%. Somewhat confident was 24%. Not confident was 4%. So we're moving in the right direction because that's what the objective was, for you to be comfortable talking to your healthcare providers about clinical trials. How familiar are you now with fintrials.com or other resources that can help you learn about prostate cancer clinical trials? So 36% said familiar, 44% said somewhat familiar, and 20% said not familiar. So that's work we're going to have to do. And we may have to have a private session just to go over FinTrials and show you to help you find those trials. Did the program allow adequate time for audience Q&A? 75% said yes, 21% said somewhat, and 4% said no. Would you recommend this session to others? 88% said yes. 13% said somewhat. No one said no. So we're on the right side. How do you rate the speaker? Excellent, 88%. Ms. Allman, so you did an excellent job.
Yeah.
And then 13% said good. So we all,
It's
oh, that's right. In matter of fact, it's probably me. That's it. You're the one who did an excellent job. I'm just moderator. All right. Would you attend another survivorship focused session? 96% said yes. 4% said maybe. How did you feel about the session's pace? 88% said just right. 4% said too fast. 8% said too slow. Were you satisfied with this meeting and the presentation content? 79% said very satisfied. 21% said somewhat satisfied. No one was dissatisfied. So that means that a lot of people walked away with a lot of good information about clinical trials and why participate in clinical trials. And then let's look at who was online with us. So prostate cancer patients, 70% were prostate cancer patients and survivors. 4% spouses or caregivers, 4% advocacy, medical professionals, about 13%, industry representatives, about 4%, and about 4% other. So we had a varying population of viewers in the audience. I wanted to, again, I want everyone to give our guest a hand. And keep on pushing and turning out those clinical trials. Well, we want more clinical trials, but turn out those new diagnostics and therapies that are out there. Very important for us. Everybody, I want to thank, again, our sponsors. I want to thank the folks here in the audience and those online who, again, shared a managing survivorship session this month. Have a great rest of your month.
Yeah.